Hi, I'm Cynthia Chauhan. I'm on the External Advisory Committee for the Patients Program. In my own life, am a patient. I have a number of chronic illnesses, including heart disease, and I'm a survivor of 2 cancers. So I have a lot of experience as a patient. I also do a lot of volunteer work as a patient advocate, particularly in research and some support work. In the context of patient-centered outcomes research, my role is primarily to provide the patient perspective, to be a representative of the patient voice, to make sure that it truly is patient-centered. I think that PCOR is important to the typical American because at this point in PCOR, which is a fairly new program, new ideas about how patients are involved in their own care and involved in the development of care models is being formulated, so that as we move down this path, patients throughout the country will have a more active, affirmative role in the development of their own care and understand better that they are partners in their care, not subjects in their care. From that, hopefully they will move to understanding the importance of research and the importance of the patient voice in research, so that they know that research is there to facilitate better care. It's not just a separate silo where some things are done. Rather, it's an avenue to enhance and improve care, and they can have a voice in that. I think disclosure is important. I am a social worker. I have been for many years. I think it is an incredible field, and what it has to offer is, when social work is at its best, its job is to facilitate and affirm the person's right to their own voice and their right to seek what is best for themselves from their community. PCOR can facilitate that. PCOR also is, I think, a way for patients to have voice and to own their role in the development of good care, not only for themselves, but for the whole community. So I think social work and PCOR are natural allies. For researchers to create an environment where patients own their role in the relationship, researchers need first to understand that patients have a role, and to step outside of the box of I'm a researcher and remember that they also are people and are likely at some point in their lives to be patients. So to let themselves value the patient comes to them as an equal partner, but with different skills and different abilities. The skill that the patient brings to the researcher is presence of patients at the table, looking at the research questions from the point of view of what does what you're doing do to facilitate people having better, healthier, longer lives. So if the researcher can let themselves be open to listening to the patient's understanding of what they're doing and presenting what they're doing in such a way that patients can understand its relevance to their lives, I think that will facilitate the relationship between the two. When I think about engaging patient advisors in the research process, I think the first step, as we just talked about, is for researchers to understand that there is a role for the patient in the research process. The second step is to reach out to clinicians who have regular contact with patients and ask them if they have patients who are interested in doing this. One of the things that is often true of patients that gets overlooked is when patients receive care that helps them to live a better life or even to understand the limits of how much better their life can be, they often become very interested in giving back. There's a natural altruistic quality that most people have where we want to give back. So when the physician turns to their patients, often they already have patients who have said to them, "What can I do to be helpful?" So the treating physician can be a bridge between the researchers and the patients to bring them together, being respectful of the different expertise of both the researchers and the patients as they bring them together. I think you need to understand that you will have a steep learning curve, and that's okay. So go in ready to ask questions. Understand that some of the things initially will seem over your head, but it's an immersion process. The more you hear it, the more familiar it becomes, and the more willing you are to ask questions, the easier the learning will be. Sometimes the questions that you ask also are meaningful to the researchers, and that it helps them to look at their research differently, to frame their questions in a different way. So even though initially you are very much in the learning position, because you're both human beings, there's an interaction, and you'll be learning from each other. So I would say relax, let yourself learn, and grow in the position. It'll be one of the most rewarding things you ever engage in.